Now, moving on to our fourth section, that is, we will be discussing injuries to the joint. In this section, we'll be discussing what are sprains, strains, and what are the ruptures of the ligaments which are actually attached to the joint, and how this causes instability, especially during the joint movement. So, what are injuries to the joint can occur through multiple mechanisms. Usually, they are injured by twisting or tilting forces, stretching of the ligaments or capsules on the one side. For example, if in such a situation, if your foot is planted on the ground and there is a valgus force which is acting on it, on your knee, that will definitely put a lot of strain on the lateral collateral ligament. It will take that load till a time it will either completely rupture or give way. This could not only lead to the increased rupture of lateral collateral ligament, but there could be a shearing fractures of the tibial condyles or even the medial femoral condyle as well. So sometimes we have to understand that there is although incomplete injury to the ligaments, but that is why because the load has been taken by the bone which has fractured. Sometimes the bone does not fracture and all the load goes over the ligaments, which results in a complete rupture of the ligaments as well. So this usually the bones which could be pulled apart as well. Other ways of ligaments getting injured is forceful angulation as well, which may be in form of tear of ligaments, or fracture separation of the physis. Although rare, but yes, it's one of the very disastrous complications which can occur, because complete rupture of the physis can be very disastrous, especially for the children. Now coming to the sprains, strains, and ruptures. So what is a sprain? It's actually a painful wrenching, twisting, or pulling, which for the joint injuries is less severe than a complete tearing of the capsule. So it's kind of a mild injury, especially if you see the diagram above. We classically get a kind of twisting injury, especially when on the uneven surfaces, usually on the lateral side of the ankle. This sometimes partially tears our capsule and ligaments, but it does not completely tear. It is classically called as low ankle sprain or ankle sprain. Now coming to the strain, there's a difference between a strain and a sprain actually. Strain is the physical effect of stress. Injury more severe than the sprain, and why? Because in this actually the bone is also taking some hit in form of a load which is acting in there. And now coming to the rupture is actually, as we know, that joints are not only surrounded by capsules and the tendons, there are also ligaments as well, which actually unite one bone to another bone, and they are also taking the load at times during the joint movement as well. So if there is too much imbalance or too much loading is occurring on the joint in a particular direction, this means certain ligaments would taking the load and eventually they would lead to rupture. Rupture could be in form of a severe stretching and twisting force, and ligament strain too. Sometimes the strain could be partial rupture and then eventually lead to complete rupture as well. Now what is a strained ligament? Some fibers in the ligaments are torn. Usually the joints remain stable, because if you see the diagram on the side is that this muscles fibers are torn, but not all, some of them are. There will be definitely edema, pain, and there will be some degree of decreased motion of the joint movement, and there is some degree of instability as well. Joint is momentarily twisted. Joint is painful and swollen. Tenderness is localized to the injured ligament only, not whole of the capsule or all the ligaments around the joint torn. So the joint is not grossly unstable, but yes, partially to some degree it is unstable till the healing occurs and the joint becomes stable again. Treatment of such is actually joint is firmly strapped or braced. It could be in form of bracing is usually the advisable form, but it could be strapped as well by the form of clamp bandages. Symptoms usually improve by rest and analgesia. You have to give the rest to the joint so that there is no cross movement, and let the healing do its business. Then active movements are encouraged once swelling has settled down and pain is actually minimized. When active movement is actually encouraged, why? Because once the healing process has advanced to a certain stage, then not moving the joint would actually lead to joint stiffness, which would be more of a disaster later on. And that could be in form of exercises. The best is if it's ankle joint, usually the dorsiflexion and frontal are the kind of exercises which are usually done for the movement in the ankle joint. Now coming to the ruptured ligament. Ligament could be completely torn. Joint is unstable. If you see the ankle joint, the classically stabilizers are actually those ligaments which are either in the medial lateral aspect plus tendo Achilles and interosseous ligament. If they're completely torn, the joint becomes grossly unstable, and joint is forced into an abnormal position at times because in form of a varus or a valgus deformity. Considerable bleeding under the skin usually occurs if there is a complete rupture. This leads to hematoma formation. There may be bruising over the skin as well. Pain is severe. There's massive swelling due to hemarthrosis, and you actually show a detached flake of bone as well, because these ligaments attach to the bony, attach one bone to another, and sometimes the ligaments are actually, the force is so much that they are not ruptured from the bone. Rather, they take a bony piece out, which is actually, there is a fracture of the bone along with the ligamentous rupture. So if that has happens, what is the treatment of choice? Torn ligaments heal by usually fibrous scarring, but we have to understand if the complete tearing has occurred, then probably we cannot allow it to heal by fibrous scarring, because later on the ligament would be not be able to function properly. So we have to, restoration of the ligament is important. Then splint or locked brace initially can be used till the swelling settles down, the pain becomes less, and the patient is at least able to do something, because the point is, once there is a lot of swelling, we will not be able to close the skin properly, and then going in at the time of swelling is going to further jeopardize the skin and soft tissue underlying this, which is already swollen. So local measures is taken in form of elevation, ice packing, so that the swelling is reduced. Once the swelling is reduced, initially the physiotherapy started, because the tendons can function normally, and those ligaments who have actually had partial tears, they would have completely healed by that time, and then we can deal with those ligaments which are completely ruptured. Classical example is the tendo Achilles rupture. Initially, maybe splintage can be done, ice packing, analgesics, and once the swelling settles down, we can get an MRI, we can get the defect, how much is the defect, whether we can primarily repair it or not, and if we cannot primarily repair it, then there are different methods of repairing it in form of a graft, in form of advancement flap and all that, but then we have to go for surgical reconstruction of that ligament. In this section, we have briefly gone through what are the joints, ligaments, strains, sprains, and what the ruptured ligament. Primary mechanism is usually the partial tears, which do not cause cross instability of the ankle joint or even at any joint. Usually are treated by conservative measures, that is in form of splints, in form of braces. Analgesia and ice packing is done to reduce the swelling, and once the patient's pain has settled down, swelling has settled down, patient is advised to start walking, weight bearing, and start exercise. The program is started. And if there is a complete rupture of the ligaments, then what we need to do is to, once the swelling has settled down, when the pain has settled down, and once the rehab protocol is started, we can go for other modalities such as MRI to assess the damage, whether the ligament is repairable or not. If that is repairable, we can go for primary repair, or we can go for surgical reconstruction of the complete torn ligament if possible. Thank you very much. Keep watching sqadia.com.